Your dashboard is green, your executive committee is functioning, and your organization is quietly drifting. I've spent more than 35 years watching healthcare systems do exactly this, and the problem is more consistent than most leaders realize. I'm Mark Medlin. I'm a healthcare leadership advisor and the founder of a consulting service entitled Stability Edge. My forthcoming book, The Stability Architect, is about how senior healthcare leaders can sustain operational coherence under continuous pressure. I'd like to tell you about what I have witnessed in healthcare systems over the years, and I'd like to tell you what I'm trying to do about it. In most American health systems today, the smartest people in the building are running on operational structures inherited from an earlier era, structures that were designed for steady state conditions in a system that no longer has a steady state. EHR transitions, AI deployments, workforce shortages, financial pressure, regulatory churn, mergers, payer disruption, ransomware threats. These no longer arrive as isolated events between recovery periods. They overlap, compound, and rarely resolve before the next wave arrives. And yet the executive committees, the governance structures, escalation pathways, and change management systems that healthcare leaders are using to absorb all of that were designed for the world of episodic disruption. They were built for occasional weather. They are being asked to hold a permanent storm that we're all in together. You can see the result. The dashboards stay green. The committees keep meeting. The improvement plans keep advancing. But underneath the surface, the organization is quietly, subtly drifting. Decisions can stop holding. High signal escalations get lost. Strong physician leaders and nursing directors quietly disengage. And the leaders running those organizations, some of the most capable people working in America today, are running as hard as they can. What I have learned over the last 35 years is that the people are not the problem. The architecture is. Extraordinary people break inside weak architecture long before they stop caring. And weak architecture is what most American health systems are quietly running today. The good news, and it is good news, is that architecture can be redesigned. I've spent the last several years building a framework for that work. 6 structural elements paired with 6 leadership skills anchored in a foundation of psychological safety drawn from people like W. Edwards Deming and from Amy Edmondson's research on high-performing teams, among other thinkers who've been important to me and my direction. It's a framework that I now use with healthcare executive teams to redesign how their organizations hold together under continuous pressure. If you're a healthcare executive carrying weight none of the existing frameworks help you carry today, if you're looking for someone to speak at a conference, your executive retreat, or your board meeting about what holds organizations together when the conditions do not let up, I'd like to have a conversation. You can visit stabilityedge.com. My contact information is there, and it's in the description below. Thanks for watching.